Hey guys, today is number day 11 after my October surgery. I got my surgery done August 11, August, oh my god, August 11, August 1, around 2 in the afternoon, my surgery started. The only reason why I was so late is because I was the second patient, and also the first patient took about 4 hours to do her surgery. Surgery is about an hour and a half, but mine took an hour and 56 minutes because my veins were small, and you can't drink or eat anything after midnight. So by the time that this first patient surgery took 4 hours, I was, you can say, a little bit dehydrated. Her surgery was not an emergency. It was just it just got a little bit complicated, and like for some reason, they just took a little bit longer with her. Everyone's different. Everyone has different kind of tubal ligations, so your surgery is gonna be different to someone else. Your surgery is gonna be more or less painful than someone else. I also think that you need to prep your body before surgery. Get your immune system better. Get your immune system going. Drink a lot of teas or supplements to get your immune system stronger, your liver and your kidneys stronger before your surgery. But make sure everything that you're doing is natural. And also, I forgot what I was gonna say. Also, make sure that you stop all your stuff a week prior to surgery. Any supplements that you're taking, I think the only thing that you can take is multivitamins. Okay, you don't have to stop it. And any medications that your doctor gives you, that your tubal ligation reversal doctor tells you is okay to take, then you don't have to stop. I didn't have to stop my thyroid medication. They actually told me not to stop it the day of surgery either. So the only thing I stopped was all my supplements. Even my multivitamin I stopped because that was just my personal choice. But I did not stop my thyroxine that I take for my thyroid. I didn't stop that at all. I took it even the day with a little bit sip of water the day of my surgery. How am I feeling? I'm actually feeling pretty good. I've had my bad and good days after surgery. I had days where I get a little bit tiny bit of headaches and a little bit of fatigue because my body is under recovery, and I do have multiple sclerosis and I do have thyroid issues. So for me, it's going to be a little bit harder than the normal average woman that don't have any medical conditions. I do feel that everything I did prior to my surgery, that I have videos of everything I took and the things I'm taking after my surgery, are helping me with my recovery, even though I have a medical condition. Surgery wasn't painful at all. My surgery was maybe like a 1 or 2. What was really painful was gas and constipation made my surgery really painful. If I didn't have that, I don't think I would have been as miserable as it was. But I took a lot of gas X for the gas. For my incision, I think it's healing really fast because of everything that I'm taking. It's healing super, super fast. I'm actually in shock how fast my incision surgery is healing. It sometimes itches, it sometimes burns. I sometimes feel pulling inside, I guess in my tubes, my fallopian tubes. But that's normal. It says it on the discharge papers that you will feel a little bit of burning, that you'll feel a little bit like pinch or something kind of pulling. It's all normal as long as it's not extreme pain, and everything I've gone through the surgery is manageable. I do feel that, like I said, you have to prep your body for surgery and you have to choose a good doctor. I think those are the main 2 things that I would advise people. Make sure you eating well before surgery. Make sure that you're doing whatever research you can. Just look at information online. That's what I did. How to recover after surgery, or how to prevent scar tissues after surgery. And from that stuff, I was buying my natural herbs and my supplements. It wasn't like I wasn't researching, what's like good to prevent scar tissues on the tube, fallopian tube, because I know there's not a lot of information. But if you go into, Google or Yahoo, and I mainly use Google, you put, how to heal after surgery, or how to heal your scar tissues after surgery. You're gonna find a lot of information on the websites. There's also this good website that I love. It's called juicingforhealth.com. And I get a lot of juicing information from there, a lot of recipes, a lot of soup recipes, and how to, what to drink after surgery. So I did tons and tons of research. One thing that I am taking that I have not shown in my other videos on my days that I am really fatigued is this natural, amazing protein. It's really good. I only take it on my days where I feel really fatigued after my surgery, and it helps. Within an hour or two, I'm feeling better after taking this. And how I take this is I think this is a 16 ounce cup, or 8. It has to be a 16 because this is pretty big. I take this cup and fill it halfway with apple juice, and then fill it about this much with water. And then I take, it doesn't taste that good, guys. It's not going to taste like the best. It's not going to taste like Kool-Aid, but it is going to do it. It's going to do what it's supposed to do. It's going to give you strength, and it's also good to recover after surgery, because protein is really good to recover. And then I take a scoop and I dump it, and then I shake it. And before I take a sip, I shake it again. Every time I take a sip, because it kind of like sits on the bottom or sits on the top. But guys, this is amazing for recovery after surgery as well. I'm gonna show it to you guys one more time. And like I said, I only drink this on my days where I'm feeling really tired. Like I feel like my body's pushing itself too much after the recovery progress, because every day you're gonna feel much better. You might feel a little bit like you're kind of sick. That's normal because you're under recovery, but it's gonna be mild symptoms. It's gonna be like maybe a little bit of headache, maybe a little bit of sweating. Those are the things I've noticed. You're gonna be bloated. Definitely gonna be bloated. You're gonna be passing gas every day. What else? You're gonna feel a little bit of fatigue, which I already mentioned that. Sleepy. Your body's gonna tell you to rest. Please rest. Do not go out. If somebody tells you, oh, let's go shopping or let's go take out the kids, try not to for at least the first week. I did that with my husband, which was a bad mistake, but I still have fun with the girls. I mean, I'm not carrying anything. You're not supposed to carry anything over 15 pounds. You're not supposed to put anything in your incision. My bed is really high, so we use a stool for me to get kind of like a potty stool. And I'm gonna show it to you guys. We use that because I'm only 4'11", and if I don't use that to get into my bed, I can really hurt my incision. I'm taking showers, but I'm doing it every other day after 7 days. I didn't wet my incision for the first 7 days. On the days that I wasn't showering, my husband was wiping me down with these baby wipes. But try to take care of yourself. It's gonna, first few days you're not gonna be able to do anything. If you're someone like me that's really hyper, you're gonna go crazy. Try to download games in your phone. Try to watch TV. I love Lifetime. It's my favorite channel. But try to, you're gonna be uncomfortable. I wasn't able to sleep I love sleeping on my left side. I wasn't able to because it was kind of bothering me. I was able to sleep on my, kind of give my back. That's another thing. You're going to have some back pain because you're always going to lay on your back. I saw videos of girls saying that do not lay flat because when you got up, it was going to be hard. I couldn't sleep like in an angle. I had to sleep almost flat. So it just, listen to your body. My husband used to help me, like he would put his hand and I would push myself up to get me back up, but I wasn't able to sleep on like I was sitting. It was really uncomfortable for me. So listen to your body and what your body asks you for, because you want to try to sleep as best as you can. For the first few days, it's going to be uncomfortable. I'm not saying I can't say painful because it wasn't painful for me. I said it was more like uncomfortable. I was in tears because of my gas and constipation, but I wasn't in tears because my incision was hurting. As soon as I used to go to the bathroom, boom, pain was gone. It was gone. Like I had no pain. But listen to your body, most of all. What worked for me not gonna work for you. What worked for another YouTuber or someone who posts something somewhere after tour versus not gonna work for you. Like I said, they tell you not to sleep on your back flat because, like I said, when you're getting up, it's gonna hurt you. It's gonna bother you. Yes, but I couldn't sleep sitting down. I had to sleep. I didn't sleep completely flat, but I kind of slept almost flat. Sometimes when I was awake, I would put a whole bunch of pillows on my back, and that would be comfortable. That would be fine. But for sleeping on, I couldn't sleep like sitting down. I couldn't. It was really uncomfortable for me. It was more uncomfortable than sleeping flat. I'm taking pictures now. I was taking pictures every day of my incision, and now I'm about taking it every other day. My incision is healing wonderful. I love the way it's healing. It's almost healed, I say. It takes about 6 weeks for your incision to heal, so you can start putting stuff on it. But my incision is only 11 days, and it looks like, I say about 2.5 of healing process. And I contributed to everything that I'm drinking and I'm taking naturally. So guys, if you have any questions, I can show you guys my incision if you guys want, or make a video with all the pictures of progress of incisions, of the incision that I'm taking. So we're not trying to TTC yet. I was just trying to conceive. We already got intimate once. He wanted to wait because he feels like he's gonna hurt me, but I told him I was fine. So we were able to get intimate, but he had to do all the work because I can't yet. But I did an ovulation test yesterday because I had this gooey stuff, mucus, come out for the first time after many years. This was my, let me put it this way, I think. This was my ovulation. Of course, as you know, both lines have to be the same, or darker. Or this second line had to be darker, so this is considered a negative. But if you can see the line, this was my ovulation test for yesterday. Doctor told me not to do ovulation tests, but my husband had to go into the store before my surgery. Want to make sure I was not pregnant. So he went and bought me pregnancy test, and he accidentally got the ovulation test, so I decided to test yesterday. So yeah, my ovulation is supposed to be tomorrow, 13th. So I'm gonna take an ovulation test today and tomorrow just to see, just for fun. But yeah, guys, if you have any questions, put them down below. Like I said, I might do a video with all the pictures of my incision, how I recovered. Every day you will see my progress, my incision. Yeah, my strips, I guess they put what you call it, them clear, I can't say it, oh my god, I have steri strips, I think they're called, and I think they also put the clear puntos. I don't know how to say it in English right now. Yeah, when they sew you up, I think it's clear. And they're healing well. I have no problem with incision. It did come on it to turn a little bit red, but I did put hydrogen peroxide on my incision because the doctor said it was okay. Do not put anything in your incision unless your doctor tells you it's okay to do so. From day 2 that my surgical pad was removed, I started cleaning hydrogen peroxide 1 time a day only, and then I would kind of take, if this was my incision, I would kind of take the incision and kind of dab it a little bit with clean napkins and just let it sit, dry, and then I would put a surgical pad. I always kept it covered with a surgical pad. I didn't take a shower for the first 7 days. I said my husband was wiping me down with these. When I wasn't taking a shower. I think number 1 thing for your surgery to heal fast is to drink natural things for scars, and also not get your incision wet. Be very careful with anything rubbing it on it too, because that clothes can kind of give you an infection too when they're rubbing. You don't know what you get in the air pollution. So make sure you guys keep it clean, keep it dry. And if you see any redness, swelling in your incision, just call your doctor right away, and maybe they can have you send them a picture and they can tell you exactly what to do. So guys, this is all I have for today. I might upload my other videos that I've had after the surgery and before the surgery. I'm not sure yet. But if you have any questions, put them down below so I can answer them in my next video. You guys have a wonderful day.